Question number 6, we have the Tzanck smear. Tzanck, Tzanck, Tzanck smear. Okay. So, before knowing the Tzanck smear, let's just go through the classifications of the herpes virus family. Okay. So, subfamily we have the alpha, beta, and gamma. Duration of replication and cytopathology. So, alpha family, subfamily, their duration of replication is short and they are cytolytic. Okay. Beta we have long, two types here. One is cytomegalic, the other one is lymphoproliferative. In gamma we have variable lymphoproliferative. Okay. Site of latency, in the alpha the short cytolytic ones are in the neurons. Then the beta ones we have the glands, kidneys, lymphoid tissues, and the gamma ones we have the lymphoid B tissues. Here we have the T cells, here we have the B cells. Nice. So beta the T, gamma with the B. Okay, genus we have the simplex virus. In the alpha we have you have two, simplex virus, varicella virus. Beta we have two, cytomegalovirus and roseovirus. The gamma we have the lymphocryptovirus and radinovirus. Wow. Okay. Official name. So simple virus, the simplex virus we have two, human herpes virus 1, human herpes virus 3. All these are human herpes virus. So in the simplex we have 1 and 2. Okay, in the varicella virus it is also called as human herpes virus 3. Now common name as same as the official in the first two, HSV1 or HSV2. So the thing is, the HSV1 or HSV2, the HSV1 wala, okay, human simplex virus 1, they cause infection around oral cavity. Okay, they cause lesions. What kind of lesions? This kind of lesions. See, around the oral cavity. Human simplex virus type 2, they cause infection around the genitalia, and it is also a highly communicable disease. So unluckily, if you kiss, then you might catch HSV1, but if you take it a step further, then you might find yourself with HSV2. Okay. Then we have the varicella virus or the human herpes virus 3, the varicella zoster virus. So this is the most common one, happens in the childhood. That is nothing but the chickenpox. Varicella is the chickenpox. What is the meaning of zoster? Zoster means the reactivation of the latent virus. See, as we have said here, the site of the latency. The site of the latency. What is the meaning of latency? Latency means where this virus goes and remains in the tissue. They are like the hiding spots. They are hiding in the tissue for prolonged time. So varicella is the chickenpox, happens in the childhood time, and zoster is the reactivation. So once it is happened in the childhood, then after like few years later, again if you are getting this virus, if the virus is again reactivating, then that is zoster. Okay, also called as shingles. Done. Then we have the cytomegalovirus. Okay, the human herpes virus 5, also called as cytomegalovirus. They are cytomegalic. That means the cells become big. They are the largest member of the herpes family. Which one? The cytomegalovirus. Enlargement of the virus infected cell occurs. Okay, and in the cytomegalovirus we have the typical owl-eye appearance. And then we have the roseovirus, human herpes virus 6, 7. I don't know anything about this. Then we have these things also. This thing, Epstein-Barr virus, the human herpes 4. See the numbering 1, 2, 3. You have 5, 1 is the cytomegalo one, 6, 1 is this thing, and 7, 1 is this. But the human herpes virus 4 is the Epstein-Barr virus, the famous Epstein-Barr virus. Right, Epstein-Barr virus, it attacks on the B cells, lymphoid tissue of the B cells. The Epstein-Barr virus causes infectious mononucleosis. That is nothing but the glandular fever seen in non-immune adult. Then we have the herpes simplex virus 8, the Kaposi sarcoma associated herpes virus. They also attack on the B cells. All those causes lymphoma. Okay, this is also called as Castleman's disease, the herpes simplex virus 8. Right. Then let's move on to the 3 marker that was asked. the Tzanck smear. What is the Tzanck smear? Definition: the cytological test. It is a cytological test. That means cells are used for the diagnosis of the herpes simplex, varicella zoster, and other vesicular disease. So what is the procedure? Scraping from the base of the vesicle. So this is the vesicles. From the base of the vesicles, we take the scrapings and then we stain with the Giemsa. And we see under the microscope there is formation of the multinucleated giant cells. So here multinucleated giant cells. Why are there multinucleated giant cells? Because after the virus infects the cell, there is formation of the viral products. Okay, these viral products are like some certain glycoproteins that will come outside to the membrane, cell membrane, and the adjacent cells along with the virus infected cells, they will get attached. Okay, they will fuse together, hence they will form giant cells. So the viral products, the glycoprotein produced by the virus in the infected cell and the adjacent cell will fuse together and they will form the multinucleated giant cells. It is also called as acantholytic cells. What do we mean by acantholytic? Acantholytic means there is loss of cellular adhesions. Okay, the adjacent cells and all, there is loss of cellular adhesions, hence they are called as acantholytic. Alright, so acantholytic cells are typically seen in skin disorders like pemphigus vulgaris. Okay, yeah, I think that's all. Okay,